In the first video of the Spay and Neuter series, we took a look at what led the veterinary profession for generations to make the recommendations for early spaying and neutering. In this video, we will take a look at some of the most recent literature and what it shows with regards to spaying and neutering at various life stages, as well as compared to leaving your dog intact in 5 of our sporting breeds. The vast majority of this most recent information has come out of the University of California at Davis, from Drs. Benjamin and Lynette Hart at the College of Veterinary Medicine. Their research has spanned more than 10 years, and they have come up with specific recommendations and guidelines for 40 breeds of dogs as it relates to the timing of spaying and neutering. One very important point to stress at the beginning is that these are guidelines, not hard and fast rules. These recommendations need to be one of the factors considered when having the discussion about what is the best path for your dog. So often we want everything to be black and white, to be applied as a blanket recommendations, and that isn't how this works. The health factors for the dogs are one part of the overall decision when people are making this decision. Prior to this research, emerging over the last 5 to 10 years, those of us working with working dogs had suspicions about some of this, but not the research to back our recommendations up. In some cases, it has validated our push to leave these dogs intact longer, and in other spots, it has thrown us a couple of curveballs. The current issue is that when you take the historic veterinary recommendations and compare them to these newer findings, it's a tough pill to swallow for many in the profession, as it means, in the past, we may have caused or contributed to some of the pretty serious health issues with our recommendations and practices. Even in the light of this new information, I have seen pushback on some online veterinary forums that people are going to be reluctant to change their recommendations. As someone who has been a science geek his whole life, it has been disheartening to me to see so many in today's world throw so much skepticism at science. Information is constantly evolving, and it isn't a failure if new science changes longstanding practices and opinions. Yet it seems in so many areas of our life, science-related or otherwise, that changing your opinion is seen as weak or a failing, when it's actually a strength. With this current research, it is also important to note that it is database driven, meaning much of it comes from looking back at historic veterinary records, particularly those that came through the UC Davis Veterinary Hospital. The reason that I offer that information up is so that we understand that while this is the best information we currently have, it too could shift. While these studies look at hundreds and in some cases thousands of dogs, they were mostly dogs that came to that hospital. This means that we are looking at a couple of factors that may influence this a bit. These are likely owners that sought out referral care, which means having the means to travel and afford a visit to a specialty hospital. And we are looking at dogs predominantly from California. In certain breeds, this could mean that certain lines may either skew the data, or once we look at populations outside of this one, we might see some shifts in these guidelines. Again, I must stress that no study is ever going to be perfect, and we need to take all factors into account, even factors that may affect studies like these. When they classified these dogs, they broke the age of spay-neuter down into a couple of categories, and these are less than 6 months, 6 to 12 months, less than 2 years, and 2 to 8 years of age. They also carefully monitored when diseases occurred in relation to surgery status. So if a dog had a disease show up at 1 year of age, but then was neutered at 2 years of age for the purpose of that condition, it was considered intact. As far as the conditions they looked at with regards to these studies, they were joint disorders, specifically hip dysplasia, craniocruciate ligament disease, and elbow dysplasia. On the cancer front, they looked at lymphosarcoma, hemangiosarcoma, mast cell tumor, and then also mammary cancer as it related to intact females. Specifically to females, they looked at incidence of urinary incontinence as well. When we look at the 40 breeds that they have examined, they have included the following 5 hunting breeds that we will take a deeper dive into. These include Cockers, Springers, German Shorthairs, German Wirehairs, Golden Retrievers, and Labrador Retrievers. While that isn't an exhaustive list, it does cover some popular breeds, and it will give us an idea of how we might extrapolate some of this information to other sporting breeds, which we will get into after we look at these specific breeds. A couple of interesting points to consider, not directly related to sporting dogs, but that illustrates the need for the specificity of this research. Overall, with the 40 breeds they looked at, most breeds are actually unaffected for these diseases as it relates to the age of neutering. They included a number of small breed dogs in their studies. With joint issues specifically, it appears to be related to body size, with small breed dogs generally not having an increased risk. Interestingly, two giant breeds, the Great Dane and Irish Wolfhounds, showed no indication of increase in joint disease related to neutering. That certainly flies in the face of what we would think. So let's take a look at the specific findings as they relate to the sporting breeds in the studies. First up is the Cocker Spaniel. Now, they did not break this into English and American, so I'm sure that the vast majority of these will be the American variety, but it's the closest thing we have. They looked at 369 cases for this breed analysis. When we look at joint disorders, at least one of the joint disorders was seen in 1 to 3% of the intact dogs. When a male was neutered prior to 6 months of age, that jumped to 11%. Spaying females was not associated with joint issues. On the cancer front, one or more of the cancers occurred in 6% of the intact males, with no increase with neutering. On the female side, there were none of the monitored cancers in the intact females, but the number rose to 17% in females spayed between 1 and 2 years, and these were all mast cell tumors. Of the intact females, 11% were diagnosed with mammary cancer, and 5% did develop pyometras. None of the spayed females developed urinary incontinence. So given this information, the guidelines that they came to for Cocker Spaniels are, for males, it is recommended to wait to neuter until after at least 6 months of age. And for females, due to that increased cancer risk, delay spaying beyond 2 years of age. Next up, let's take a look at Springers. The total sample size here was 212 dogs. On the joint front, when they looked at intact male and females, the occurrence of one or more joint disorders was 5 and 8% respectively. When they looked at spaying and neutering, there was no increase in joint disorders. I find this interesting as Springers are usually a little bit bigger than Cockers, yet here we didn't see the increase with neutering that we did in the male Cockers. With the monitored cancers, they occurred in intact dogs at a 6% level, and altering did not increase this level. With mammary cancers, intact females had a 6% rate, and for those spayed between 2 and 8 years old, a 15% rate. No pyometras were reported in the intact females. When looking at urinary incontinence, females spayed at 6 to 11 months of age showed a 13% occurrence of urinary incontinence. When taking this information into account, the guidelines for Springers are, if neutering a male, it's up to the owner's wishes as to the timing or not. With females, the only notable issue is urinary incontinence, and so it is recommended to wait until after 1 year of age. I need to put a disclaimer here so that I don't ruffle any feathers. I know that folks can get pretty excited when drop hairs and wire hairs are lumped together. For the sake of these studies, y'all may get really uptight, and I'd ask that if you're driving or standing to pull over or sit down, because they grouped German short hairs and wire hairs into the same group. I'll give you a moment to recover. There were 443 dogs in this population, so more than double the number of the Springers they looked at. The joint disorder numbers are very interesting for this group. Historically, we have harped on the need to keep males intact until skeletal development occurs due to testosterone's influence on growth plate closure. For the most part, we've just kind of excluded females from this part of the discussion. For this population, the intact male and female dogs had occurrence rates of 3% and 2% respectively for joint disorders. In male dogs neutered prior to 1 year of age, there was a slight increase in rates of cruciate ligament disease. The interesting statistic is that in females spayed before 6 months of age, the number jumps to 38% having at least one of the joint disorders monitored. I found that number to be astounding. On the cancer front, the intact males and females had rates of 6% and just 1%. In males neutered before 6 months of age, there was a significant increase in the rate of 8% of mast cell tumors and hemangiosarcomas over the intact males. On the female side of the cancer equation, those spayed before a year of age had a significant increased risk of lymphosarcoma, up to 11%. With mammary cancer and pyometras in the intact females, the rate was 4% for both. With spayed females, the urinary incontinence they classified as insignificant increase to 6%. When taking into account the increases in joint disorders and cancers, the guidelines for both males and females is to neuter or spay no earlier than 1 year of age. I saved Golden Retrievers and Labradors for last, as I feel they provide a very unique look as to why this information is needed and why assumptions can't be made. The numbers used in each of these breeds was more than all of the previous groups combined. First, looking at Golden Retrievers, they included a total of 1,247 dogs in this group. As with the other groups, we'll look at the joint disorders first, and those numbers were 5% and 4% for intact males and intact females. When we look at neutering of males, if done before 6 months of age, that risk jumped to 25%. And if done between 6 and 11 months, it still jumped to 11%. In females, the findings were similar, with an 18% risk if done before 6 months and an 11% risk between 6 and 12 months. I think this would fit with our more recent thinking of letting large breed dogs reach skeletal maturity. Cancer is where things get really interesting in the golden population. Intact males had a high incidence rate of cancer at 15%, whereas intact females, it was only 5%. Neutering males at less than 6 months of age increased the rate to 19% and between 6 and 11 months to 16%. Spaying females at less than 6 months raised their rate to 11%, between 6 and 11 months to 17%, and spaying at 1 year and at the 2 to 8 year window still increased the risk to 14%. The mammary cancer rate for intact females was just 1%, and for those spayed at 2 to 8 years, just 4%. The pyometra rate was 4%, and no cases of urinary incontinence were noted. So what does this mean for the guidelines for Goldens? With males, due to the increased risk of joint issues and cancers, would be that if you are going to neuter, to delay it until after at least 1 year of age. Females present an interesting conundrum. If based solely on the data with increases in cancer at all spaying ages, it might be best from the health standpoint of the dog to leave them intact and remain vigilant for pyometras as the dog ages. This is also the subject that very much changed my opinion, at least exploring ovary-sparing spays. I will confess that I was very much against them, but in the case of the Golden Retriever, it may very well be something to consider. Admittedly, I have zero experience with this and need to dive a little deeper. If you are going to spay a female Golden, then you will want to wait beyond 1 year to at least address the joint concerns and then remain hypervigilant for the cancers that may occur. Moving last to Labradors, one might hypothesize that the findings would be similar among similar retriever breeds. So let's take a look. For Labradors, not surprisingly, they looked at the largest number of dogs at 1,933. Starting with joint issues, one or more joint disorder was noted in 6% of the intact population. In males neutered prior to 6 months of age, this increased to 13%. On the female side, those spayed at less than 6 months, the risk was 11%, and between 6 and 12 months, it increased to 12%. I think it is interesting to note here that for a number of years, we have discussed waiting to neuter a male until they are skeletally mature. In some cases, that may even be more important, or at least as important, again, for the females, as was illustrated in several of these breeds we've talked about. On the cancer front, intact males saw an 8% rate, and intact females, it was 6%. Spaying and neutering at any age was not associated with any evident increase in cancer risk, quite the opposite of what we saw with the Goldens. For intact females, the mammary cancer rate was 1% for intact females and 2% for those spayed at 2 to 8 years of age. The rate of pyometras was just 2%. The urinary incontinence rate was in the 2 to 3% range at various ages up to 1 year. The guidelines they established with this information for Labradors are, for males, due to the increased rate of joint issues waiting beyond 6 months of age, which would fit with the common practice of at least waiting until skeletal maturity, which is going to occur later. And for females, here again, the issue is concerned for joint issues, which they saw in the groups under a year of age, so waiting to spay beyond a year of age. I think this really drives home the point that this really needs to be an individualized conversation and not something as simple as the question we see in internet chats of, when should I spay my duck dog? Or when do I neuter my bird dog? It really is more nuanced than that. I think this also sheds some light on the fact that the extremes of early spay and neuter, and you can't spay and neuter at all, are both not necessarily correct. As we evaluate these issues, we can make sound decisions that satisfy a lot of owners' wants and desires for their dog. I also think it needs to be noted that these are guidelines based on what many would still consider to be a relatively small population size, even for the retriever breeds. We are selecting for groups here that had the socioeconomic status to seek care at a university veterinary teaching hospital in California. I don't note that to discredit any of this, but rather to lay the groundwork that as the profession does more work like this and we start pooling larger numbers, some of these recommendations may shift or change. That doesn't mean anyone is or was wrong. It means we are improving and changing, which is a good thing. Even though we only covered 5 breeds, maybe 8 if we get into segregating out those German dogs, this has gotten much longer than I was hoping for any one of these videos. In the next video in the series, we'll take a look at some of the miscellaneous studies that contribute to the discussion dealing with things like longevity and behavior and how they need to be factored into this overall individualized discussion as owners and veterinarians navigate recommendations, decisions around spaying and neutering. In future videos, we'll get into what this means for the breeds that aren't covered. And then in the final video of the series, my hope is to kind of bring this all together so you can make decisions about your dog.